unto the path from which they had lost their way. At another time, there was a man who, as he was harvesting, on his threshing floor, he had stolen some hay from another farmer who was in the area. And to his dismay, it caught on fire and began burning, and he didn't know what to do. So he ran to Simeon's cave, and he asked the great father, "What should I do, Father? Tell me what to do, because I've got this hay burning, and everything I've got is going to burn down." And Simeon simply said, "Well, if you will return that which you have stolen from others, the fire will indeed go out." And so it happened, not from any dousing of water, but as soon as the man had returned what he had taken, the fire went out of its own. At another time, Simeon had cultivated a desire to visit Mount Sinai. And so he did, wanting to retrace the exact steps of Moses himself. And he got there, and everything had seemed quiet, but Simeon wasn't getting the response from the Lord that he had hoped that he would. So he stayed there and stayed there and stayed there in solitude until finally he heard a voice from heaven saying that it was time for him to depart. And when he opened his eyes, there were 3 apples in front of him, which Simeon took and ate, and then went along his way. Now, Simeon encountered many such things during his life. Some of them may seem fantastical to us today, because what we don't understand is that in our very busy and harried and crazy lives that we live, the idea of God somehow seems to recess into the clouds, far away from us. Things are just a little too real for all of us in this age of cell phones and computers and unceasing media barragement that we get every day. But when one is brought quiet,
The ancient faith for the modern world. This is Ancient Faith Radio.
Welcome to Healthy Minds, Healthy Souls with your hosts, Father Nicholas and Dr. Roxanne Lowe, where we will connect our Orthodox faith to day-to-day living in relationship to our family, our work, and our view of ourselves. Father Nicholas is the priest at St. John the Divine Greek Orthodox Church in Jacksonville, and Dr. Roxanne is a licensed clinical psychologist who uses her extensive training in private practice. Your questions are welcome by calling 855-237-2346. That's 855-237-2346. Here now is Father Nicholas and Dr. Roxanne.
Well, good evening, everyone, and welcome to Healthy Minds, Healthy Souls. We are so delighted that you're taking the time to join us on this Tuesday, June 8th evening. My name is Father Nicholas Lowe. I'm the parish priest at St. John the Divine Greek Orthodox Church in Jacksonville, Florida. In fact, this is a ministry of that church. And I'm also joined by my wife and lovely co-host, Dr. Roxanne Lowe, who's a clinical psychologist. And every couple of weeks, friends, we come together to bring you a show that we hope that aims to help you in your walk of faith by merging faith and psychology. This show has been all about practical Christianity. We don't want you just to hear the word. We want you to go out and live the word. And so we hope that we're giving you that. And so if we encourage you that if you're the first time listener to our show, you can find out more about us and our ministry by going to our website at thelows.com. That's LOUHS.com. We also encourage you to join our social media family. We're on Twitter, Instagram, and Facebook, and again, all under the headings of The Lows. And if you're one of these people that love to receive encouraging messages, and Roxanne and I are definitely people like this, we encourage you to take a moment during our show and go to our website at thelows.com and click on the subscribe button. Every single day, Roxanne and I send out just a word of encouragement to kind of guide you throughout your week, to kind of keep you strong in your walk of faith. So if you're someone that's looking for some inspiration, some encouragement all throughout your week, definitely go and subscribe. Again, it's at thelows.com. Click on that subscribe button. All they're going to simply ask you for is to put your email address in. There's no strings attached. You just simply put your email address, and then every single day you'll receive an email from us. And as always, we encourage you to join the conversation tonight, especially on the topic that we're going to be covering tonight. You can call into the show at 1-855-237-2346. That's 1-855-237-2346. You can also email us a question during the live broadcast of our show by simply putting ask@ancientfaith.com in your email server. It's ask@ancientfaith.com. And we are also simultaneously airing our show on Ancient Faith's Facebook page. So you can also if you're on Facebook right now, go to the Ancient Faith radio page, and you can plug in a question and ask us. We'd be more than happy to try to answer it during the show. And again, as we do this every single time that we offer our show, if you don't feel comfortable sharing your name, we totally understand, especially on the topic that we're going to be covering tonight. You can simply just remain anonymous. We definitely will respect and honor those wishes.
Well, tonight we are talking about a topic that is gripping our nation, an epidemic so great that it kills roughly 136 people per day. We are discussing the opioid epidemic. And in 2019, according to the CDC, an estimated 10 million people were found to have misused opioids in just that year alone. And the number of drug overdose deaths has actually quadrupled in our nation since 1999, with over 70% of those deaths involving opioids. Tonight, we are blessed to be joined by a Greek Orthodox priest, Father Anthony Salzman, and two addiction experts, Mr. Chris Thrasher and Reverend Dr. Von Reiten. Chris serves as Senior Director of Substance Abuse Disorders and Recovery within the Clinton Health Matters Initiative of the Clinton Foundation. He oversees all of the foundation's efforts to help raise awareness about substance use disorders and their treatment within our communities, while also empowering faith leaders to play an integral role in destigmatizing substance use disorders. Reverend Reiten has over 30 years of experience as an addiction professional and leader. He is the coordinator of the Addictive Diseases Initiatives for the Department of Behavioral Health and Developmental Disabilities and State Opioid Treatment Authority. And Father Anthony Salzman serves at St. Philothea Greek Orthodox Church in Watkinsville, Georgia, and has since 1999. He is also a founding member of Bread for Life, a workforce development program in Athens, Georgia, which helps people get back into the workforce. He's also regional spiritual advisor to the OCF, Orthodox Christian Fellowship. Reverend Reiten, Father Anthony, and Mr. Chris, welcome to the show.
Good to be here. Thank you.
Absolutely. Chris, we hear about the opioid epidemic regularly, but what really is it, and how did we get here in the first place?
Well, first, thank you, Father Lowe and Dr. Roxanne and everyone at the Ancient Faith Healthy Minds, Healthy Souls radio show for inviting all of us here this evening. It is a real pleasure to be with all of you. So, Father Lowe and Dr. Roxanne, let me begin by answering your question just from a numbers perspective. You know, Dr. Roxanne, you had just shared that 136 people a day are losing their life to a drug overdose. I wish that were still the case. And I say I wish that were still the case because preliminary data that was just recently released from the Centers for Disease Control for the last year revealed that in just 12 months, we are now up to 88,000 deaths every year. This is where we're headed. That's up 29% from the previous year. And, you know, we know that deaths from overdose have increased during the COVID-19 pandemic as those who are struggling with substance use disorders have had to find ways to cope with this added stress, with the isolation, you know, the disruption to our daily routines and not having our support systems in the same way that, you know, were before COVID happened. Now, let me just break down that number. Of the 88,000, as you said, Dr. Roxanne, you're exactly right. 2/3 of those deaths have been from opioids. Nearly half of those deaths are from synthetic opioids like fentanyl. But now if we break down that number even further, 88,000 deaths every year equates to about 240 deaths daily. That's 10 deaths every hour. So in the hour that we're on this radio show, another 10 people will lose their life to this disease. I mean, that's 1 every 6 minutes. This is now the leading cause of death for men under 50. You know, when we think of other epidemics or other, you know, realities that our country has faced, I mean, AIDS, about 16,000 people every year. Gun violence, 36,000 every year. The entire Vietnam War was 58,000 American lives. You know, so now you can kind of put into perspective what 88,000 lives really looks like. And I'm not including the 88,000 additional lives from alcohol. I'm not including the 45,000 deaths from suicide. This is, you know, this is a reality. I mean, and it goes state by state. Here in our state of Georgia, where I reside, our population is about 10.5 million people. In 1 year, 541 million opioids were prescribed, which equates to about 51 opioids for every man, woman, and child in this state of Georgia. And this reality, it's not unique to Georgia. This happens everywhere, which is a part of how we got here. But more importantly than all of the numbers that I'm throwing at you, you know, the reality is that these are moms and dads. These are brothers and sisters. These are our sons and daughters. These are our husbands. These are our wives. All of them with a story that will never be told as a result. But Dr. Roxanne, you said, how did we get here in the first place? Let me share with you exactly how we got here. So back in the 90s, pain became the 5th vital sign for our healthcare professionals. So you all know taking our temperature, our pulse, our respiration, and our blood pressure are the 4 vital signs. Well, pain became the 5th vital sign. And physicians actually were graded on their ability to reduce or eliminate their patients' pain. And at the same time, insurance companies were tying reimbursements to a physician's ability to reduce or eliminate a patient's pain. Well, at the same time that was happening, pharmaceutical companies were prescribing or were manufacturing these drugs and telling their physicians that prescribing these drugs were safe. They were non-addictive and they treated pain effectively. And what happened was overprescribing happened. And then as people saw these problems, they cut them off, which created a new type of addict. See, because we typically think of addicts as someone who might be, you know, the stereotypical type of addict. What we were seeing now were, you know, the 10th grade who sprained his ankle on the football field, or, you know, someone who, you know, hurt her arm playing basketball. We're being prescribed these highly addictive opioids and then cutting them off. And what happened was these people were incredibly addicted and then went out to find their own source of the drug that they were addicted to, leading to, as I would say, a new type of addict, if you will. But opioids, you know, in the United States, we make up about 5% of the world's population, but we're responsible for 80% of all opioids prescribed. And that's, you know, it's a huge, huge issue. We estimate that about 40% have what we call a co-occurring disorder. which I think is underestimated, but you would know, Dr.
Yeah,
Roxanne,
sure.
a co-occurring disorder is, the folks that you treat, I think very often that come in with some sort of mental illness, but also struggle with a substance use disorder.
Yeah, three-quarters of those with depression struggle with pain. Yep.
Absolutely.
And substance abuse is following with the pain. Yep.
Absolutely. And addiction, it affects all of us in some way, regardless of our age, our race, our gender, our socioeconomic status. I mean, creed, and I'll say this, religion or even lack of religion. We know that this addiction is an equal opportunity, disease and will affect all of us. So we need to do something about it. Let me just take another minute, though, to share with you why, we at the Clinton Foundation think that our faith leaders can play a vital role in addressing this crisis. I think it's super important to just sort of think about our faith leaders in the position that they play in our communities. And I would suggest to you that Sunday or your day of worship in the week is still perhaps the most segregated day of the week, which I think provides both an opportunity and a challenge, because more than a third of Americans attend religious services weekly. And I know, and I think we can all agree that individuals turn to their faith leaders in times of crisis. In fact, a recent study that I just saw that persons seeking treatment for mental health crises were more likely to contact or reach out to their clergy than they were psychiatrists or physicians, medical doctors. So you're put into this position as a faith leader of sort of being the catch-all. And faith leaders are often in what I might call a long-term relationship with many of their congregants, which enables them to detect the signs of distress and intervene, but only if they feel confident and capable, of doing so. So I want to pause there because I wanted to just make the point that I think our faith leaders have a huge, huge role in being able to bring our communities together and to be able to, help these folks that are suffering from the disease of addiction.
It's so telling, Chris, what you're sharing with us, because I think, I felt like, for maybe about 6 months or even maybe a year, maybe even 2 years, this dominated the news. You were hearing about the opioid crisis day in and day out. We were watching videos. We were seeing situations of children watching their parents in the car who overdosed on opioids. And it was like a gut-wrenching moment every time we would watch these situations of these people who, as you mentioned, beautiful. These are our neighbors. These are our church members. These are people that are just potentially maybe through an injury, through some sort of an accident, got addicted to the opioids, and we're seeing this pandemic, an epidemic really impact us. And I think one of the things that over the last year has kind of been quiet because everything has been obviously we've been dealing a great deal with the other great pandemic of COVID-19. But I just love how you were sharing that, and I hope our listeners are hearing this, that, 88,000 people every year are dying because of this crisis. And it's something that we as a society, and especially as people of faith, especially on our show, we talk about this all the time, talk about practical Christianity. It's how do we become a light? How do we become an instrument, a vessel of helping those who are in need? So you're listening to Healthy Minds, Healthy Souls. We're so grateful that all of you are joining us tonight. We are talking about the opioid crisis. And if you would, if you're struggling yourself with an opioid addiction, or for that matter, an addiction, or just want some general answers to your questions, feel free to call us at 1-855-237-2346. That's 1-855-237-2346. You can also email us a question at ask@ancientfaith.com. We're also broadcasting our show on Ancient Faith as well as the Lows and on my personal Facebook page. So if you are on Facebook right now, definitely take a moment. If you want to ask us a question, you can always remain anonymous in doing so. So Father Anthony Salzman and Reverend Von Wrighton, I think as priests and as pastors, you would be the best people to talk about this. I mean, what would you tell the listener tonight that may be feeling very ashamed and angry about a loved one's addiction from a spiritual or faith-based perspective? In other words, what would you tell someone that may be struggling themselves with an addiction, not knowing how to get help, also feeling ashamed because they really don't have anyone to talk to, but also someone that is dealing with someone who has an addiction? How would you tell them that from a faith perspective?
Go ahead, Reverend Vaughn, and I'll go second.
Well, I would start
I would start with saying tonight, first of all, thank you all for allowing me to speak with you. But I would start with letting people know that there's hope.
Mm-hmm. Amen.
And that's really important, because when we feel ashamed and we feel angry, we feel frustrated, we feel depressed, it's because we've lost hope. We just think that, that it's not possible that they can get better, and that, the family members have been through the process of dealing with their loved ones, relapsing and promising, I promise I'll do good. I promise I'll make it this time. Mm-hmm. Or even just trying. I tried. And they tried so many times. And every time they try, they fail. And, it's one thing to fail, in public, and it's another thing to fail in private. And so it's difficult for the person who's actually trying. And when you're dealing with addiction, you're dealing with a disease. And so sometimes it's not that the person doesn't want to try, and it's not that the person doesn't want to get better. You're dealing with a disease that this person has. But there is hope. I want to stick with that. I want you to know that people do recover. I mean, when I started out in this field a long time ago, someone asked me, they said, why do you help those people? They're never going to get better. And I disagreed. I disagreed over 30 years ago that people do get better. And I've seen thousands and thousands and thousands of people now, whose lives are better. In fact, some of my former, clients and individuals that I serve, they call me, or when they see me, we laugh and we talk about the things that they've been through and where they are right now. And some are just seriously successful. So I want people to know tonight that there is hope, that people do recover, that they do get better, that recovery is real and it is possible. And I would tell you also that recovery happens wherever God's grace falls. And wherever God's grace, whenever that happens, that can happen in the therapist's room. That can happen in a room where there's AA or NA. That can happen in the faith, in your place of worship. But wherever that happens, wherever God's grace falls in that person's heart, that's where it really begins. And so I think if we pray for God's grace to fall on our loved one's heart, His prevenient grace to fall, and His strengthening grace to fall on their hearts, I believe that God will deliver, and I believe that it is possible.
Absolutely. Absolutely.
And I would add to that what you identify is that we're dealing with a stigma. When I first became aware of this problem and got involved in this project, I tried to think, do I know anybody? Is there anybody in our community? Who is this message for? And then I realized there was a family I knew that they were prominent, they were wealthy, their son got in an accident, so he went on opioids, and then in a matter of time he was addicted, and then he overdosed. And it broke their hearts, it just crushed them. So it's there. And if we can talk about it, and if we can get help, that will begin the process of healing. And we have a saying that love covers a multitude of sins, and that's what it takes to get through this sort of situation. And as Dr. Reverend Vaughn mentioned, that some people don't think there's hope or that you can't be healed. But if you ask anybody who's in AA, they understand that I'm sober today, that it's not forever, but I'm living today sober. So it's maybe the nature doesn't change, but perhaps the will changes, the will to stay on a path and to get help and to be healed from this disease.
Absolutely. And for those of you who don't know, I mean, we're using the word opioid, but, for those of you, looking over at your spouse, your brother or your sister, and you're wondering, are they at risk? Opioids are a class of drugs found, naturally in the environment, actually, but they basically relieve pain. That's what they do. And they're prescription medications, often referred to as painkillers. They can be found on the street as heroin. You've heard of heroin, but they also come prescribed. And of course, they're not as strong as heroin, but this is how people start. This is sort of the track to heroin. And it's the prescription opioids such as OxyContin, Vicodin, fentanyl, which is more of a synthetic opioid. And then we also have hydrocodone. So, these are the things that you're looking for. And, unfortunately, we don't know when we start taking these drugs who's more susceptible to addiction. And we know with these drugs that we do build tolerance. And so we do need more and more over time with these drugs to warrant the same effect, which is how people end up on heroin, unfortunately. So, but thinking about the fact that, 40 to 60% of our individual susceptibility to problems is our genes. So you don't know when you go in for, like you said, Father Anthony, someone goes in for surgery, you get put on a painkiller. We don't know. If you're one of those people with this sort of increased susceptibility where you're going to end up needing such high amounts of these drugs that you're going to end up needing the next best thing and the next best thing and the higher and higher doses. We just received an email that came in from somebody whose brother-in-law just died this year from fentanyl-laced opioids. And it happens to the person sitting right next to you in the pew.
Right,
that
exactly.
you don't even realize. Right. But I want to go to the calls really quick. We have a call coming in from George. George, are you there?
I am.
Welcome to the show, George. Thanks for calling.
You're welcome. Thank you. I sent you a message earlier. I'm an acupuncture physician, and acupuncture has been scientifically proven to be as effective as opioids in reduction of pain. And I think we really need to come around to alternative methods to opioids, and this is the best one. It has a 2,000-year success rate of being in pain relief. They've used it when somebody has to be on opioids, like after surgery, and if they use it in combination with the opioids, they have to take less opioid, and they have to take it less often, so there's less chance of addiction. Right now, just recently, Medicare has started paying for acupuncture for chronic low back pain. So it has a history of being fairly successful. It's also used very successfully in drug treatment facilities to reduce the withdrawal symptoms and the cravings.
That's wonderful. I'm so thankful that you called in because, again, when we're looking at the whole body, mind, body, and soul, we are looking at everything that we can do holistically from a whole person perspective, spiritually, emotionally, and physically, that can help set us up for success in a world that is filled with temptations of the flesh that prey on our flesh. And so acupuncture, that's great to know. So if someone is looking to help reduce pain and not wanting to start off on opioids, seek out an experienced acupuncturist, making sure they're licensed and maybe somebody who specializes in pain relief.
Yeah, there's an organization that actually has diplomats in acupuncture. It's called the NCCAOM, and I can't remember exactly what those letters stand for, but they're a clearinghouse for acupuncturists. So if somebody's looking for a good acupuncturist in their area, they can just go to NCCAOM, and I think it's .org. It may be .com, and just put that NCCAOM and then put acupuncture. If you search for that, it'll bring it up, and they can give you a list of qualified acupuncturists in their area.
Wonderful.
George,
thank you, George.
Yeah, George, thank you so much for calling. I think that's so helpful for people that are struggling to have another area that could be potentially helpful. And taking a step back a little bit to all of to Chris and to Reverend Von Reiten and to Father Anthony. There may be some people that are tuning in tonight and they're asking this question: how do I know if I or someone I love is addicted? Can maybe, Chris, we can begin with you. If you can just kind of share with us, how do people know if they are addicted, or if someone that they love is suffering with addiction?
Sure. Thanks very much, Father Lowe. I guess what I would say is to trust your gut. When dealing with friends, loved ones, family members, siblings, we know in our spirit. Sometimes it's not as obvious, because one thing that is a reality is that people with substance use disorders try and hide it as best they can very often. And because they try and hide it, it sometimes makes it more difficult to, to figure out, do they really have a problem? And then if you confront them, all too often people with a substance use disorder will tend to minimize or rationalize their behavior. And so, it's difficult. There is no sort of magic bullet to try to figure out, or a litmus test, that if they do these three things, they're automatically considered a person with a substance use disorder. But the reality is that if you feel it in your gut, in your spirit, that this person has a problem, the thing to do is to talk to them about it. Let them know that you care. Let them know that you're there for them. Let them know that they're a safe, that you're a safe place for them to come and talk to. All of these things are reassuring for persons that suffer from the disease of addiction. I mean, often, what we're really looking for is someone to care, someone to take an interest in, my lack of hope, as Reverend Dr. Von Shuri said. If I have no hope, it's very, very difficult. But if someone comes to me and reassures me that, they will help me find that hope again, I think I can begin to talk to them. So trust your gut and trust your spirit is what I would say.
Yeah, and I think too, as I was listening to you, Chris, I think so often, when people are, have a loved one that they are concerned about, or they think that they may have a potential a problem or an addiction to opioid, or for that matter, any type of addiction. Obviously, as you mentioned beautifully earlier, that there's definitely a reluctance that this is to minimize it, to disregard it, and then sometimes obviously they get angry and say that this is my life, I know what I'm doing, and you're interfering in that. But how do we empower those people who live in a home where someone that they love is an addict, or someone that they are deeply concerned about? What are some practical ways, I guess, that we can encourage our listeners that when they see someone that when it gets sometimes so draining, when you've addressed it time and time again with them and still nothing is happening or there's no movement, what would you say to them to keep on going, or another avenue or another way that could maybe inspire them?
Well, I think that there are support groups for family members who, because addiction is not just an individual disease, it's also a family disease. So this is also affecting the family as well. And so there are support systems out there for family members as well. There's Al-Anon, there's Al-Anon,
the century, part 1 and 2 on HBO, to see how long this thing has been developing and in process, and that how it affects families. And what Reverend Vaughn said some beautiful things about the health of the individual, but it is dependent on the health of the family. And that an experienced priest can have some resources that they can offer to help people overcome the stigma, address the problem, and work through it.
And I would add to that, Father Lowe, that we hear from the faith leaders that we work with all too often that they lack a language from the pulpit to talk about these issues. Right. But we also know that faith leaders have this unique ability to help foster change and shape and influence and inform the attitudes that so often contribute to inequities. Changing the mindset that addiction is not a moral failing, but rather a treatable disease, I think is going to be one of the keys to fighting and ultimately beating this epidemic.
Absolutely. I love hearing what you're sharing. I'm sure it's being very helpful to all of our listeners. And once again, you're listening to Healthy Minds, Healthy Souls. We are discussing tonight one of the greatest epidemics of our time, and that is the epidemic of the opioid crisis. And we're speaking with 3 professionals on this topic. But we encourage you, if you or someone that you love is struggling with an addiction, and you're just needing some guidance, or you're needing some answers, some questions to be answered, please don't hesitate. Call our show. You can do so at 1-855-237-2346. That's 1-855-237-2346. We're also simultaneously broadcasting all over social media on Facebook. So if you're listening on Facebook and you want to share it, go ahead and share the show on your to your friends as well. But we're also going to be answering questions that come through those feeds as well. We actually have a phone call that came in today from Father Michael. Father Michael, are you there? To your friends as well, but we're also going to be answering those feeds as well. We actually, Father Michael, if you can lower you're on your end, and welcome to the show.
Thank you. I just wanted to respond to the question of how you discern whether someone has a problem. And obviously the best thing is to start with an evaluation by an addictions professional. But some of the things that we look for when someone comes in, we get a history of their drug and alcohol use, is we listen for things like mental obsession. Someone who has a drug and alcohol problem, you could just tell when they're talking about their use, there's an obsession with it. And then you look for a physical compulsion, how often do you use? And I mean, there are many things that you can discern. And then you look at their lifestyle, and are they continuing to use drugs and alcohol despite a series of negative consequences? A marriage broke up, they lost a job, they had numerous accidents. So there is data, and maybe it would take the professional to do the evaluation. And I live in Bethlehem, Pennsylvania, but most cities and towns, you can pick up the phone and you can have an evaluation done. Even now with teletherapy over the phone, where an addictions professional can, look for some of those things: compulsion, obsession, continued use again, and causing negative consequences over and over again, and not changing that behavior. So I wanted to throw that in. It's not very hard to get an evaluation. It's covered by insurance in most cases, and it can be done over the phone right now. And you could have a referral into treatment. It's a little harder to get beds, sometimes inpatient, but there's pretty much consistent outpatient treatment that's available. So the resources are there, and I think if there's a need there, or someone says, I think I need help, that's the time to move, because other times, not necessarily when they're high, but the need to just reach out, pick up the phone, find someone who can do an evaluation locally and let them be assessed. And they could be we place people immediately, either in outpatient treatment or if there's an inpatient bed. So the need is great. The resources might be, fall a little bit behind, but there are evaluations possible, and there is some kind of treatment that could be made available, even if it's outpatient, just to get started.
I love what you're sharing, Father Michael, because I think really on two levels, Roxanne, as he was talking, I just kept thinking to myself, on the one end, it gives us all hope that if you have a family member or someone that you know that is struggling with an addiction, that the amount of resources that are out there, that are available to you. But it also kind of reminds us that we should never give up as well, that sometimes I think when we're it's so easy that when we're dealing with someone in our family who may have an addiction, to give up on them, to simply say, you know what, if that's how the life that they're going to live, then let them live that life. I can't, I've tried, and we kind of give up on it. And what we're hearing from Father Michael and obviously our panelists is really that there's so many resources that don't stop. Keep doing what you're doing. Keep, as the Bible says, carry each other's burdens and fulfill the will of Christ. And I know it's difficult. I know it's challenging. But in that, I think what we're hearing, though, is not only just the amount of resources that are there, but also the opportunity to never give up when trying to help someone who is struggling.
Right. Thank you so much for calling in, Father Michael.
Yes.
Thank you.
Thank you so much, brother, for tuning in. I appreciate it.
And, rehab programs, obviously can be quite expensive. Sometimes even Father Michael mentioned hard to find beds. Are there any faith-based Christian recovery programs or support groups that any of you know about?
Chris, if you want to go ahead and start that out.
Sure. Yeah, thanks. Well, first, what I would say is, that the rehab industry is a big business, and it's even a bigger business with this opioid epidemic. I mean, it's about a $35 billion a year industry. And unfortunately, there are no national standards. And that's something that we in this field are working on. I mean, if you can imagine, if your loved one has cancer, what's one of the first things we do? We want to find the best specialist, and it doesn't matter what state they practice in. We'll drive across the country, we'll fly to get there, and we do that for our loved ones. But imagine your son or your daughter or your husband with a substance use disorder, and you Google, rehabs in my area. And how do you know which ones are, reputable? Do I say, oh, well, because this one is twice as much, they are probably twice as good? That's not the case. So, unfortunately, right now, what the reality that we're up against is you have to start reaching out to people that you know and that you trust, and just ask, similar to how we would do it with any sort of crisis in our lives. We talk about it. We ask questions. Now, the only good thing about the number of people that suffer from a substance use disorder is that we probably don't have to reach too far in our circles of support to find someone else who has been there before.
Right.
And they are willing to come down in the hole with us and say, don't worry, I've been here before and I know the way out. But let me say this, I'm someone who's living in long-term recovery. I have over 31 years of abstinence-based recovery. And I will tell you that when I went to my rehab, I had no desire to stop the way that I was living. To reiterate what the father who called in said, I was fully obsessed with my addiction. And, obsession, to give you sort of a definition that I think is easier to understand, is a fixed idea in our heads that takes us back time and time again to that symptom of our disease, that fix, that pill, that drink, that drug, knowing that only physical, mental, and spiritual harm comes when we use that substance. And then compulsion, conversely, is once we have started that behavior, we cannot stop on our own. It literally takes an act of God. And that's where I think, and that's why I think our faith leaders are so important in this dialogue.
Absolutely.
Yeah, absolutely. And, I love what you said earlier too about, and I can't echo this enough, that this is not a moral failing. This is not a moral failing. This is operating at a physiological level, and it is, in a sense, impossible to stop once the addiction has set in on our own. Addressing the motivation for change takes more than just good intention. To stop, it's an uncomfortable switch. And the examination of how is this compromising me spiritually? emotionally, physically? How is it moving me away from my purpose and God's calling on my life? We start to examine the biblical principle of, is this my will or his will? And starting to think about the notion of what else it is I value, because nothing is going to feel as good as that substance when you are addicted. So there has to be this sort of very powerful pull in another direction. And Chris would probably love to spend some time talking with you about what it was that helped you make that switch, because, you know, we have to reach a point in our life where we realize that the pain that we're in from our addiction is worse than our fear of change. And there's an equal and opposite pull in the other direction of something else that we value that is so much greater. And that's not an easy that's just not an easy switch that we can just sort of talk about and hope we enter.
No, you're absolutely right. You know, substance use disorders have complexity, but it's really going to require a cultural shift. You know, because as I said earlier, this epidemic cuts across all demographics, and it's really going to take a village. And if you think about a house of worship is really all about community. It's all about people coming together for a common purpose, a common need, a common hope. And so, you know, I think it's going to take a community working together. You know, I often say that there are 4 F's that make up a community, and that's family, friends, faith, and food. And it's going to take all of us working together. This is healthcare professionals and providers, parents, teachers, families, you know, public policymakers, researchers, law enforcement. I mean, really the fabric of the community coming together. And, you know, what I think is that the faith-based community is the glue that holds all of us together, because as that old saying goes, 1 + 1 + 1 is far greater than 3. So we need to find out, you know, who are our community influencers and invite them to the table. You know, there's an old saying that if you're not at the table, you're on the menu. So we need to work together, come to the table, and be willing to roll up our sleeves and do the work to help, you know, the 88,000 lives that are being taken each and every year here in this country.
Yeah, you know, and I think too, as just in the church world, you know, and I think this is across the line with all faith traditions, is that there also needs to be a great deal of much more conversations, I think, as you mentioned earlier, Chris, with regards to, from the pulpit about this, because there's no doubt that I know in our community, there are people that definitely struggle with an addiction to opioids, and it's not, and we obviously through confession and through conversations and through helping them create a village with professionals, medical professionals, therapists, as well as rehab facilities. We're doing, I think, what we can within our means. But I do think it's so important for our listeners to hear that churches are called to be hospitals, not country clubs. And so if you're, you know, the Bible says, Christ says that I didn't come to help the well, I came to help the sick. And so churches by their very nature are supposed to be hospitals. And one of the beautiful things, and I know Father Anthony could speak about this as well, is in the Orthodox Church, you know, so much of our liturgy is said in the plural. It's not in the singular. It's not like, you know, have you done this and have you become this? You know, it is always, you know, for the sick and the suffering, let us pray, let us, plural, pray to the Lord. For, you know, there's this constant idea of community. And I think when you said that earlier, Chris, it just kind of spoke about how worship is so much of a village experience where we're trying as a team to be on part of God's team, to help people, to help his children who are dealing with this crisis. So I just love what you had to say. I thought it was just so appropriate. And for those of you that may be struggling, please reach out, whether to your priest, whether it be to a medical professional, but do not stay where you are. I always say to our community, where you are today is not where God wants you to stay. So there's got to be, there's something greater that God has a purpose for in your life. So work towards that. Once again, you're listening to Healthy Minds, Healthy Souls. We are so grateful that you're joining us this evening. We are talking with Father Anthony Salzman, Chris Thrasher, and Reverend Dr. Von Ryden about, I think, one of the biggest topics that really should be at the forefront of every single news cycle, should be on our hearts and in our prayers every single day, and that's the opioid crisis. We heard earlier over 800,000, listen to this everyone, over 800,000 people a year are dying from this epidemic. And so we have to do better, and I hope that our church as a whole and faith leaders will do a better job. But we encourage you to join the conversation. You can call in at 1-855-237-2346. That's 1-855 237-2346. You can also email us a question at ask@ancientfaith.com, ask@ancientfaith.com. And listen, some of you are listening to the show right now and you may feel very uncomfortable, like, I don't want my name to be on there. I don't want them to call out my name. We understand. You could totally be anonymous, but please do not miss an opportunity to get some of your questions answered.
And so from a faith perspective, let's talk about this for a moment. What are the spiritual implications of drug abuse in general? Reverend Von Reiten and Father Anthony, do you have any thoughts to share on that?
When you say the spiritual implications, I'd like you to just say a little bit more about what you mean by the spiritual implications. And I think I got it, but I want to hear you say just a tad bit more about that spiritual implications.
I think the gist of it, Reverend Wright, is this as a spiritual battle, spiritual warfare.
Yes.
And so maybe you could talk a little bit about that.
Okay. Well, listen. When I often talk about this when I worked as a program director at a faith-based recovery center for several years. And so a lot of times I would integrate what I call the sacred and the secular idea of treatment and recovery. And in that integration, in that part of it, there was one scripture that usually resonated with most of the individuals that I would serve. And I think it comes from Romans. I think it's around the 8th chapter where Paul was wrestling. And he said, the thing that I don't want to do, that's the thing that I do.
Yes.
And the thing that I do want to do, that's the thing that I don't do. And the beauty of that step, there's a step in there that finally comes to that. As he's wrestling, there's a step in there. He says, thanks be to God. He says, who can deliver me from this body of death? Who can deliver me? And thanks be to God through Jesus Christ. In other words, I use that as a step moment. He says he came to believe that a power greater than himself could deliver him from the body of death. He came to believe that only through Christ could he address this spiritual pain that he was in. That was a painful passage for Paul.
Amen.
He was in a painful place.
And I think, Father Nick, as you mentioned earlier, that the church is the hospital of the soul. It's where we become better, and we are talking specifically about opioid addiction. So people may not consider themselves in that equation, but really the goal is much higher than just being delivered from something, but it's to become something. And for Orthodox Christians, that's theosis, that is to become like God. So on any level, anything that keeps us from freedom, from free will, from loving, if we turn anything into a God, something that we worship, something that we have to have other than Christ, then we all have work to do. And as has been mentioned, there's not a silver bullet. You can't just do this and it will go away. It is a battle. I use the illustration in these battles against any addiction, whether it's alcohol or pornography or opioids or whatever it is, that we have to fight back. And as you see in people playing basketball, if you can just get your finger on the ball in trying to go for a rebound, you can change the direction of the game. So we have to fight as wise warriors in that process of theosis, in that process of becoming like God.
Absolutely.
Let me add something to that, and that is, it was back in the 80s that Hazleton, one of our preeminent rehab centers in the country located up in Minnesota, started to recognize that the disease of addiction was a physical, mental, and spiritual disease. And that if we were going to have any hope at helping people to rehabilitate, that we were going to need to treat the physical component, the mental component, and the spiritual component. And so often when I'm in my recovery circles, the word hope is brought up. You heard Reverend Dr. Von Shuri talk about hope. And it was probably about 15 years ago that I put a pen to paper and decided, what does hope really mean? Because when I say the word hope in a circle, people's head nod up and down as if we have this common universal definition of hope. But I would suggest to you that hope is a very individual thing for everyone. And so when I put pen to paper, I decided that hope was an acronym. And the H stood for health. And that meant spiritual health, mental health, physical health, all aspects of health. The O was for opportunities. In my recovery, Father Lowe, I have had so many opportunities. I came into recovery as a 9th grade high school dropout. And, my biggest dream was to get a GED. And I was able to not just go back and get a GED, but go on for a 2-year degree and then a bachelor's degree and a master's degree and go on to study for my PhD. So opportunities were abound. The P in hope was for power, as in a higher power or a power greater than myself. And finally, the E is for education. One of the things that my dad told me when I graduated from NYU with my master's degree, he said, Chris, you're going to go through life and meet a lot of people. Some will have more than you and some will have less than you, but make me a promise that no matter who you come across, you treat everyone with respect. And perhaps more importantly than that, remain teachable. And for me, education doesn't happen just in the ivory towers at some of these institutions and colleges and universities, but educations actually happen in the basements of churches, mosques, and synagogues at 12-step meetings, when I listen to people share their hope, their strength, and their experience, and I glean from that, and I take from that, and I apply in my life. Recovery is all about hope. And when I ask myself, how do I do this or how do I do that? How is honesty, open-mindedness, and willingness. If I'm honest with myself, if I'm open-minded to hear what you might suggest, and if I'm willing to try, my grandma always said, God will move mountains for you, Chris, but you have to bring the shovel.
I love that.
And Chris, those are spiritual principles, Chris, what you just said. Honesty, openness, and willingness. Those are all spiritual principles, to recovery. I believe they are.
Yep,
absolutely. So, what are the resources, if you're someone listening to this show and you are someone who is struggling and has been sort of on the fence about getting help, what resources are available to people to learn more about this epidemic and what they can do to help themselves or somebody that they love?
Let me say this to you all.
Yeah,
Let me say this
please.
to you all. One thing, I do want to go back to something, and it ties into the resources. So, we talked about treatment programs and things like that. I want you all to know that, okay, for example, in the state of Georgia, there are treatment programs all over the state that the state pays for. The federal government funds every state to pay for, and at the state of the state you're in, your state government funds those programs to pay for. So I don't care; it doesn't matter what state you're in. I know as a state opioid treatment authority, as I work with other states across the nation, that there are treatment programs in your state that are funded for individuals who cannot afford to pay for treatment. So there are free programs all over your state. So I encourage you to reach out to your state departments, wherever in whatever state you're in, and ask them. And for us, it's the Department of Behavioral Health and Developmental Disabilities in the Office of Addictive Diseases. There's going to be in the other states, mental health and addictive diseases will be tied together. I need you to check those things out because treatment is there. So that's a big resource, right, for everyone to have. The other thing I want you to know, in the state of Georgia, though, for those of you who are in Georgia, I love to point people in the direction also of not just treatment, but in recovery and peer support. And so in recovery and peer support in the state of Georgia, we have a warm line. It's called the CARES Warm Line. It is staffed by individuals who are peers who have been through or in recovery and have been trained to support individuals that are going through. And so the number for that is 844-326-5400. I'm going to say it again. Because I want you all in the state of Georgia to call that number if you got a loved one who you think you're concerned about, and if you're someone who's concerned about yourself and just trying to make it and trying to find your way in this recovery process. There's hope. And so the number is 844-326-5400. 5400. That's the CARES Warm Line in the state of Georgia. And I encourage you to utilize it.
And I will add to Reverend Dr. Von Churi's suggestions a couple of national resources. First one, of course, one of the oldest ones, Alcoholics Anonymous. It's just aa.org. Narcotics Anonymous, na.org. na.org. A couple ones that you might not have heard of, dailystrength.org. This is for more than just substance use disorders. This is about 500 different support groups for anything you can imagine. Dailystrength.org, all one word, dailystrength.org. Another one, r20.com, R like recovery, and then 20.com. This incorporates a more holistic approach to recovery. And then finally, the one that Von Churi already mentioned, but I'll say again, is for those family members, because we know addiction is a family disease, we have Al-Anon or Nar-Anon. Nar-Anon is for Narcotics Anonymous, and Al-Anon is for Alcoholics Anonymous, but those are the support groups for the loved ones of alcoholics and people with substance use disorder. So alanon.org and naranon.org.
And I would add to that, as part of our participation in this project, we are each given 2 boxes of Narcan. Now, you may not know what that is, but it is a reversal drug, especially, I guess, in fentanyl, cases of fentanyl where there's an overdose. It will reverse the effect. It will save the person. You may not ever need it, but you should at least know about it, and we have those resources at our church, and we'll train people. And according to the law, you cannot be convicted or sued or held responsible for doing something in an emergency situation involving an overdose if you use Narcan. And if it isn't an overdose, it's not going to hurt anyone. Is that correct, Chris? Did I get that right?
You're absolutely correct. It's for opioid overdoses, including fentanyl. But yes, often we are the first responders. And so what we train people to do is to call 911 and administer naloxone or Narcan, as Father said. And hopefully that buys the time to get the first responders to be there. But if everyone were to carry Narcan, I can assure you we would have a lot less overdose deaths in this country.
It is unbelievable how this 1 hour has gone by so quickly. I want to take this opportunity just to once again thank you to Chris Thacher, Father Anthony Salzman, Reverend Von Reiten. Thank you so much for being with us tonight. I just hope and pray that that the people were as inspired as we were listening to all three of you speak. We just want to once again encourage all of you. If you have someone that you are, that maybe it's you that you are struggling with an opioid addiction, do not settle. God has something greater in store for you. Please seek help, whether through your parish priest, whether through a medical professional, but do not settle and do not buy into the devil's lies of just simply thinking that it's just not that big of a deal. We also encourage you to check out our brand new book, Renewing You, a Priest, a Psychologist, and a Plan. You can find it right here at Ancient Faith. We also want to thank Matushka Trudy for producing this show. And if you've enjoyed this show, please help us to share God's light by telling people all about our show and to join our social media pages, all under the lows. Our next show is Tuesday, June 22nd, everyone. Have a blessed day and stay strong in your walk of faith.